The India Mental Health Alliance recognizes how critical it is to set up forums, convenings, and opportunities for cross-sectoral conversation, bringing people with lived experience and from communities together with those across the development sector, organizations working in women and child, education, livelihood, together with mental health grassroots organizations, is really what will help us conceptualize what an ecosystem of care might look like.
When I think about IMHA and where we started from, a very important aspect is how resonant we stay with everything we do in terms of our practices, in terms of capacity building, in terms of community work with the values and principles, working alongside people, privileging the lived experiences of people.
To expand the idea of mental health, to take it out from the clinic-based, expert-driven biomedical model that we've been following for so many years. Mental health resides in every space in the community, in every aspect of life. And if we keep waiting for things to eventually lead to a crisis in the form of acute mental ill health, then we are losing the plot. And if we are able to engage with the stakeholders at various stages, maybe parents, teachers, policymakers, employers, then the whole model becomes what we call a developmental model.
Our inner state of being, which is our mental health, directly impacts every intersection and every part of our quality of life and how we show up in the world. And if you're able to open this up as a definition, then I do think that the way we look at care or treatment or management of mental health, mental illness, and the impact of it on everyone around us, I think that changes. We now have more than 200 members in the Alliance from different parts of the country. We will work with and for the Alliance and maybe make some headway in trying to, make sure that the mental health system in the country evolves, adapts to growing needs, focus on trust areas and trust populations, use a lifestyle and a life course approach.
Collaboration is probably the only way forward. And in that sense, the Alliance, which is the first effort of its kind, is bringing together people, organizations, their partnerships with communities and the lived wisdom that comes from there.
I am supporting the Alliance because I have not seen such an initiative for a few decades that I have known Indian mental health scene for. I have great expectations from this Alliance because I know that the leadership is very passionate about mental health. It brings together lived experience of people, but also highly trained, specialized management capacity and mental health skills together. We know that many organizations are already joining this Alliance and many more will do so in the coming months and years. And that force will be something that will change the whole scenario for mental health in India.
India Mental Health Alliance exists to ensure that we can play a role in strengthening the ecosystem.
Working on capacity building programs with communities and by communities, and also with mental health professionals, and put in place programs co-designed with them that are able to help them overcome skill gaps or quality gaps with the intention to say, how do we mainstream mental health as a development issue?
What makes IMH's work so essential in my view is not just what it's building, but how it's reimagining the very structure of mental health capacity in India. First, need to ensure that all qualified mental health professionals in the ecosystem have access to the tools that equip them fully to support the complex mental health needs in our society. It invests in our key community stakeholders. The teachers, frontline workers, HR professionals, even the police.
Previously, all our philanthropy had been in the space of education, but we had personal lived experience with our elder daughter, and that sort of brought our attention to the space of mental health. We would really love to see many other philanthropists come together to work towards this movement, to create capacity, to create alliances, and to bring the sector together to be able to support the ecosystem of mental health in this country.